Good day, everyone. I hope everyone is doing well today. Today is Wednesday. It's Nclex What, When, Where Wednesday. All right. Today we're going to talk about what is a tension pneumo and what should you do about it? When can that occur? What is that related to? And where and in what kind of situations? All right, so that's our question of the day, and you're going to get a little bit of some more Nclex tips as well. So, first thing, I just want to mention to like, share, and subscribe if you're enjoying these videos and if you're learning some content on how to pass your NCLEX. So, chest injuries, that's what you want to think about when a patient has a pneumothorax, a tension pneumothorax specifically, then this patient has um, had some type of injury, a chest injury. So, if a patient has a tension pneumothorax, you want to know what are the signs and symptoms. All right, well, what is it first? It's a rapidly fatal emergency. It's easily resolved, and as long as we can recognize it early on with early interventions. I can't really say it's easily resolved, but it can be. Now, it occurs when an injury to the chest allows air to enter the pleural cavity. Remember that pleural cavity, that little area, that little space there that is between the lung? Well, air can enter that pleural cavity. That's that little space between where the actual lung is and your outer part, your chest wall. And there's no way for that air to escape. All right. So every time that patient breathes in, additional air accumulates in the pleural space. And that's going to create or an increase intrathoracic pressure. That extra pressure is going to lead to the lung collapsing. So anytime you hear of a pneumothorax, the lung has literally collapsed. It cannot expand. This increased pressure causes compression of the heart, the great vessels, all those blood vessels, bringing blood in and out of the heart, and it pushes everything toward the unaffected side. And we're going to see evidence of this by a mediastinal shift, and you're going to see distended neck veins. Now, what results of all this? Well, this patient is not going to be able to pump blood out effectively, so they're going to have a decreased cardiac output. They're definitely going to have some alterations in gas exchange. There's your nursing diagnosis. And all this is manifested by severe respiratory distress. Patient's going to be hurting, chest pain, low blood pressure, hypotension, tachycardia, and definitely whatever side that bar or whatever penetrated into their chest, whatever side that lung collapse, that's where you will not hear breath sounds, an absence of breath sounds on the affected side. Now, the trachea is very important to look at the trachea and see if it's midline, because if it's a tension pneumo, the trachea is going to be deviated to the unaffected side. Tracheal deviation. All right, now cyanosis. If you wait till your patient becomes cyanotic, then that is a late sign. It's a late manifestation of this clinical situation. And of course, it is life threatening. So we're going to diagnose it. We're not us, but it gets diagnosed based upon the patient's clinical presentation. But you, as the nurse, you're going to be able to look and know that this is what is occurring medically. Treatment is never delayed to confirm presence with a chest x-ray study. So you go ahead and start treating it as if when they have all the signs. You recognize that it's a tension pneumo, and you know immediately, you're going to anticipate as the nurse that you need that the provider is going to immediately decompress. Immediate decompression of the intrathoracic pressure is accomplished by a needle thoracostomy. All right, and that's where, they insert this needle. It's pretty big, 14 gauge needle, into the second intercostal space in the midclavicular line on the injured side. Now, this procedure converts a tension pneumo to just a simple pneumothorax because it's going to release some of that air out. And then subsequent definitive treatment is going to be required with placement of a chest tube. So then, get your x-ray, and probably the patient will end up with a chest tube. The first thing you want to do, however, when this happens is close the site. You want to close that area because you want to put an occlusive dressing so that air can escape, but more air doesn't go in. So a three-sided dressing. So in this question, we're going to go through. We have to do, I think this is an in order, ordered step question, and you're going to have to put in order the steps to what you're going to do as a nurse for this patient. All right. So also, in the comments, I don't want you to miss tomorrow's webinar event. It is a free webinar. All you have to do is sign up. Um, lead in your signing up, you'll give your name. You don't have to give your last name, just last initial, but all I really need is your email. Put your email so that I can send you the Zoom link. All right, that's how you sign up. So click the link. That's going to take you to purchase a ticket, but the ticket is free. And you're going to see when you click on it, it says buy ticket, but it's free. And that event is going to be tomorrow morning at 11 a.m. Tomorrow morning at 11 a.m. That's Eastern Standard Time. This is going to give you the opportunity to see if online tutoring would be helpful for you. And particularly, this is for the online course. So the course is going to be live. You may have some sessions that are recorded, but for the most part, it is 12 weeks. It is, we call it the Online School of Nclex Review. So I don't want you to miss it. Come and join us tomorrow morning, and it's free. You can ask questions. You can listen to me talk again about what is going to be in the details for you, what it's going to include, any packages and things like that. So if you're interested and you think you really need something like this to help you pass your NCLEX exam, then I have the answer for you. All right, enjoy the rest of the video and enjoy the rest of your day. Focus on the now. Never ask someone else to do what you can do in the NCLEX world. They'll ask you delegation questions. All right, very good. So with this one, you have to put in order. These are the next two questions are some commonly missed. They're probably the top missed questions for physiological adaptation that I see. And you want to put in order, chronological order, what to do for this patient. So their physiological problem is they got a penetrating chest wound. And there's a rush of air coming out through the trauma site. So they either got stabbed in the chest or something impaled them or rammed them in the chest, and now air is coming out. All right, so what would be the first thing you want to do? So remember, it's an intervention. Interventions are nursing actions. So the first thing that would fix the problem or help this patient or keep them safe, what would be first? Should we do oxygen, put a dressing, blood gas, or pain? All right, very good. Awesome. So if you said two should actually be first. Very good. Two is going to fix the problem. Now, it doesn't really fix the underlying problem that they got this hole in their chest and they're probably going to develop or are developing a pneumo because air is now rushing in through the trauma site. But with the first thing you want to do is do something that helps the patient. So think about your problem. What is the problem? They got stabbed or something went in their chest. I need to cover that site. That's going to prevent more air from rushing in, which is going to create more problems. The more air you get in your chest, the greater the pneumo. But we also want to cover it so that air doesn't go in, but air can come out. So maybe like a 3-window dressing. All right, so that fixes the problem temporarily. It kind of prevents it from getting worse. All right, what's next? I see some 4s are being 2-4. What would be next? All right, we got 1. Very good. So oxygen. So when you look at these, you have one says, check the blood gas. One says put them on oxygen. They're both dealing with airway, breathing, and circulation. However, the next priority is what else fixes the problem or helps this patient? ABC, airway and breathing, get them on some oxygen because now their lung, their chest area is compromised. And what will the ultimate goal for this patient is to get a chest tube put in. So you're going to begin that setup, get things ready for the doctor to put in the chest tube. All right, good job. All right, then the next thing we're going to do between 3 and 4, you're right, 3 and then 4 should go next. When you look at monitor blood gases, this is also a way to prioritize. Again, you go back to your prioritization: airway, breathing, and circulation. And remember Maslow's hierarchy of needs. Our interventions can be guided by what is the patient's need? What do they need? They need all these things. Well, how do I know what comes first? Prioritize based upon Maslow's. A patient's need or their problem is a part of Maslow's. So first, we're taking care of physical needs. The top physical needs are airway, breathing, and circulation, putting the oxygen on, getting the chest tube. All right, next, you want to go ahead and get the ABG, see where their oxygen is. What is their O2, their PaO2, what is their PCL2, all right, and see if they're going into respiratory failure. Do we need to go ahead and intubate this patient? All right, so that's next. When you look at pain as far as a physical need, pain comes after airway, breathing, and circulation. Monitor just means you're going to assess their blood gas. Whether you interpret it as being you're going to obtain it, somewhere they had to obtain it in order for us to be able to go back and assess it and look at it and see what is it. Is it good? Is it bad? Are they deteriorating? You want to get that before you medicate them, because what if they do need to, we don't want to put a lot of what ifs in it, but what would I want to know before I give pain medicine? I want to know vitals. I want to know how is their blood gas before I medicate them with pain medicine. All right, very good. So great job on that one. For the pneumo, this is just a little clip of some things, some interventions. Collaborative management. Oxygen per nasal cannula, 2 to 5 liters. Position them from optimal ventilation. How would we want to sit someone up for who's having trouble breathing? We want them in semi-Fowler's or a Fowler's position, sitting up. And their good lung, you want down or back. So either just straight up is best. But if we had to do some turning, then if if the bad lung was on the left, I would want their good lung down, because you want them to aerate the bad lung by having it up. So good lung is down. We do want to close the open sucking chest wound with gauze dressing. You want it taped on 3 sides so that air can escape during expiration. So he inhales, but when he exhales, that air can come out, so it's not creating a further pneumo. Prepare for that chest tube. Now, analgesics, they're going to be in pain, but they're going to be in doses adequate to allow the patient to cough, deep breathe as indicated. So I would want to know and they didn't mention ABG in here, but according to Maslow's, we want to know that ABG result first.